Hello, my name is Romola Bucks and I'm the director of the Raine Study. What is the Raine Study, you might well ask? Well, give me a few minutes and I'll tell you. The Raine Study is Australia's longest running public health study and one of the most extensive multi-generational cohort studies of pregnancy, childhood, adolescence and young adulthood anywhere in the world. The Raine Study is currently celebrating the extraordinary milestone of 30 years of world-class, life-changing research. Celebrations for our 30th birthday commenced in late 2019, but because of COVID, we're taking every excuse we can to keep the celebrations going. We started by recruiting 2,900 pregnant women from 1989 to 1990 with the intention of studying the role that early life events, from the womb onwards, have on later life, and secondly, to investigate the effects of frequent ultrasound scans during pregnancy. We've followed up those parents and their children regularly ever since. The original children in the study are now in their 30s and are having kids themselves. In addition to mothers, children and their children's children, one of our follow-ups has also included grandparents. So, what do we know about these amazing volunteers who we've been working with for 30 years? What don't we know about them? To name just a few things, we know whether they were bullied as a child in school. We know about whether they have vision or hearing difficulties. We know about how they're getting on at work. We know about their mental and physical health. We know about their sleep. We know about their living circumstances, who they were living with and where they were living. We know about whether they took risks as adolescents. We even know whether they have tattoos. If you're a cancer researcher, we have sun exposure data for you. If you're interested in the genetics of heart disease, we have data for that too. If you're excited about understanding the relationships between asthma and diet, we can help there as well. The Raine Study has something for almost every topic a health researcher could want to investigate. But there is even more potential in the coming years. We already have data on our participants from birth to 30, data that have helped us to understand the early life origins of health and well-being in young adults. Our next challenge is to continue to source data on these same people as they enter their 40s, 50s, and 60s. We're looking for scientists and clinicians to work with the data we already have and join us on the journey to collect more. We're hoping that one of those people might be you. So what do you need to do to find out more? Check out the Raine Study website and scroll to our page for researchers. Attend our webinar on May the 25th at 10 a.m. Perth time, where you'll hear more about what the Raine Study has to offer and have the opportunity to ask questions about how you could use Raine Study data in your own research. Come along to our interactive workshop on June 23rd from 10 a.m. to 2 p.m. at the QE2 Medical Campus in Perth, where experienced Raine Study researchers will tell you more about the Raine Study and how you can get involved. This hands-on event will give participants an opportunity to workshop an early concept for use of Raine Study data into a feasible plan on a page, helping you take your first steps as a Raine Study researcher. Places are limited. We hope to see you during our webinar so that we can welcome you to the Raine Study community.